Hi everyone, welcome to Fit It In. I'm here with Dr. Maggie Cadet, NYC Rheumatologist. She's incredible, and emergency happened at FitRx that she couldn't join us.
So sorry.
That's what happens with doctors.
Yes, there's always an emergency.
We're going to talk about the impact fitness has on our health of our body today.
Great, one of my favorite topics.
Dr. Maggie, what role does regular exercise play in managing inflammation, especially for people with autoimmune or joint-related conditions?
So we do know, like with aging, there can be some inflammation that occurs. And it's really, really important that we all decide to move. Obviously, exercise has great properties, especially on the heart and the lungs, but let's not forget our joints, because we need to keep moving into our 80s and 90s as like longevity increases. So exercise can stimulate the production of your joint fluid called synovial fluid. And that synovial fluid helps lubricate your joints and keeps it going. It leads to less joint stiffness, less joint pain, and just better movement. Exercise also decreases body fat. So we know body fat plays a role in heart disease. It has a lot of pro-inflammatory, so promoting inflammation effects. Well, exercise decreases this body fat, and so it decreases the risk of inflammation. The great thing about exercise as well, it also increases anti-inflammatory chemicals in your body that's secreted by your immune system. So when you exercise, all these chemicals that are anti-inflammatory will be secreted in your body. And lastly, it does help with joint flexibility and, again, less joint stiffness.
Is there a minimum level of intensity that is required for all of this to happen?
Well, it's a great question. For patients with arthritis and autoimmune disease, you don't want to push too much. Obviously, movement is important, but you have to modify your activity. Also, something as simple as walking, you don't need to run to actually exercise. Walking 10 minutes a day to start, then increase up to 30 minutes a day, maybe 5 days a week, 150 minutes per week is enough. Don't forget also you could do yoga and Tai Chi, which also promotes better joint function.
I know that's a level that Dr. Anuwala suggests as well. She's a cardiologist.
Yes, so cardiology and rheumatology joints, there's a lot of similarities and a lot of interplay, right? Because again, inflammation can affect your heart as well as your joints. So we work together.
How can someone tell the difference between normal workout soreness and signs of something deeper, like joint inflammation or arthritis?
Now that's an excellent question, because we all experience, even seasoned athletes experience just like joint soreness from working out. If you continue to have joint pain, joint soreness for a prolonged period, so maybe more than a few days, it becomes more intense. If you have muscle weakness, so not soreness but weakness, that is a sign that something else is going on. Also, any other joint swelling, if there's redness of the muscles in the joint, it's really important that you see a doctor.
So this kind of goes along with you need to allow your body to rest.
Absolutely.
So if you allow your body to rest, you should recover. And if your muscles don't recover, is that what you're talking about?
Yes, like rest is always important. Just keep in mind with a lot of the autoimmune diseases like rheumatoid arthritis or lupus, there's other things going on. So it might not just be your local joint activity, it might be your actual body and your immune system that can also cause muscle weakness and extended muscle soreness, but it's your immune system that's overactive as well. So if you listen to your body, if you don't feel right after a few days, or if it's prolonged, if it gets worse, or again, if there's weakness, a rash, fevers, extreme fatigue, then you definitely want to ask your doctor.
Now it's time for a myth buster.
Okay.
What is one movement myth you wish would disappear when it comes to joint pain or aging?
Okay, so I will say two things. People with arthritis or have, they also feel like they shouldn't move because, right, they think that movement will cause pain, when in fact, that is a myth. Joint movement, even a little bit, as I mentioned, 5 to 10 minutes, 15 minutes a day, can actually lubricate your joints more. It actually causes your muscles around the joints to get strengthened and stronger, so that way that lessens joint stiffness and joint pain, and increase joint flexibility. A lot of people feel like if they're over a certain age, like 60, they shouldn't move as much, and we're living longer, so we definitely want to keep our bodies fit. We want to keep our muscles and joints active. We want to keep our joints lubricated because we want to also avoid falls. We want to avoid lack of coordination and balance. So just keep moving no matter what age, but check with your doctor to make sure that the movement that you're doing is right for you, because everyone's different. And also listen to your body, as you said. If you feel like one day it's pushing yourself too much, then just take a pause.
I mean, that's what Sweat for Smiles, that's what I'm doing with Sweat for Smiles, is trying to inspire people to move, and there's so many different ways to get movement in.
Absolutely.
So I love hearing that. Let's see.
I think Michelle Obama mentions Let's Move campaign, and it's true because there's so many benefits to just moving. Like I said, you don't need to run a marathon or, do tennis or something that places pressure on your joints, but you can do yoga, you can do swimming.
You can dance.
You can dance, Zumba, Pilates. I mean, some of these are mat classes, strength training is also really important to help build
pickleball.
Yes, again.
Are there any early signs of joint or autoimmune issues that people who train regularly should watch for?
Yes, so as I mentioned before, if your joint pain increases or sustains itself for many weeks to months, that's a key. If you have extreme fatigue, and I know we all have fatigue, especially as mothers and professionals, but there is that type of fatigue where you can't move out of bed. If you have a rash or photosensitivity rash, that could be a sign that something's going on. Again, weakness, joint swelling, even when we do exercise in the gym, you really shouldn't have joint swelling, joint warmth, or again, joint redness. So those are other signs that you want to look out for. And fevers. If you're having a fever when you're exercising, it could mean that something else in your immune system is working.
Yeah, and it can be frustrating to have to stop moving, but you should listen to the body.
You should listen to your body. Or take a pause. It's also important while you're working out, take a 5-minute recovery pause. Doesn't mean that your workout's less. It just means that your body is giving itself time to recover.
Last question. Are there certain types of movement you recommend or advise against for people managing conditions like rheumatoid arthritis or lupus?
I would say, again, try to pick exercises that are not so strenuous on your joints, so where you're stopping, rotating too much. Because patients with rheumatoid arthritis, they have limitations, right? They may have, just pain in their joints, stiffness. So what I would recommend is doing light impact weights or light impact activities like walking. Again, yoga, modify your yoga and Pilates if you need to. Swimming is a great sport because it definitely does not put stress on your joints. So I would probably recommend those activities. If you want to get into the more moderate activities, strength training, as I mentioned before, it's really important to do a couple times a week. It helps with your bones as well as your joints, and again, promotes anti-inflammatory effects. So I'm going to stick to those. Hiking is also a big thing. So, again, like I said,
I love hiking because when you're in nature, fresh air, that's so good.
Yeah, that's great. It's good scenery. And there's so many online apps now too where you can meditate and walk too. So you're getting both benefits, mind and body is working together. So
okay, well, thank you, Maggie.
Thank you, guys.
Where can everybody find you?
On my Instagram account, Dr. Maggie Cadet, CADET. Sounds like that, but
I'll tag it here.